my name is Vicki Williams, and I will be giving a presentation on the opioid crisis. And this is for the RN to BSN program at Mississippi University for Women. Objectives. By the end of the presentation, the learner will be able to give a clear definition of what an opioid is. The learner will be able to explain what the opioid crisis is. The learner will be able to describe how the opioid crisis has affected the economy. The learner will be able to list at least 2 signs and symptoms of opioid abuse in patients. And lastly, the learner will be able to identify ways health care workers can help combat the issue of opioid abuse. Opioid crisis is the misuse and the addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids such as fentanyl, is a serious national crisis that affects the public health as well as the social and economic welfare. What is an opioid? An opioid is a drug class that is prescribed by doctors to reduce pain levels. Examples of opioids are OxyContin, Vicodin, morphine, and an illegal drug, heroin. Opioids act on the brain and nervous system to block pain signals. Were first introduced in the 1990s. When they first came out, pharmaceutical companies ensured that the medications were low risk of addiction when introduced to the market. Economic burden. 115 people died per day from drug overdose, mainly opioids. The Center of Disease Control, the CDC, released an article that stated America spends about $78.5 billion per year on the following due to the misuse of opioid drugs: healthcare cost, addiction treatment, loss of production, and justice involvement. The opioid epidemic by numbers, and this is according to the CDC in 2016. 116 people died every day from opioid-related drug overdose. 11.5 million people misuse prescription opioids. 170,000 people use heroin for the first time. 2.1 million people had an opioid-related disorder. 948,000 people used heroin. Most time after they are introduced to the narcotics, after not being able to get the euphoria that they get from using the prescribed medication, they often venture out to heroin, which is the next choice. And these other numbers on here are very astounding. When you get a chance, if you would take a look at them. This is back in 2016, so we can imagine where we are now with these numbers in 2020. Signs and symptoms of opioid abuse. Signs and symptoms that patient may be abusing heroin are confusion, noticeable euphoria in patient, consistent changes in behavior, constricted pupils, constipation, and slowed breathing. How can you help? Thoroughly assessing patients on the initial encounter with them can extremely help by identifying patients that may be seeking medications or that may be experiencing a drug overdose. Teaching other ways to manage pain. Other ways to manage pain can include exercising, physical therapy, massage therapy, and cognitive behavior therapy have shown to help with pain management as well. Monitoring your work environment. Oftentimes we work alongside with people that may be experiencing using medication or abusing medications, and being aware of your work environment can help with this also. And also not leaving medications that are controlled out where other people can get them, such as patients and visitors and things like that. Communicating efficiently with the medical provider. Doctors trying to manage pain with other drugs that are not opioids, such as your over-the-counter medications such as Tylenol and ibuprofen. These things should be tried first before we elevate the patient to a controlled substance such as narcotics. Also, in the utilization of an electronic narcotic database, and this database gives information on a patient's drug history as far as getting medications filled, what prescriber prescribed them, and if they are doctors seeking to get drug medications for pain. And that concludes the opioid crisis presentation, and here are a list of references that were referenced in this video. I hope that it was formative and you were able to get something out of it. Thank you.